what are the risk factors for the development and progression of diabetic retinopathy? It's very important that the diabetes is extremely well controlled, and this needs to be done with a general practitioner or diabetic physicians. The second risk factor is smoking, and really people with diabetes shouldn't be smoking. Thirdly, hypertension, and if there's any suggestion of blood pressure, that needs to be also very well controlled. Fourthly, if your cholesterol is elevated in liaison with a GP or diabetic physician, this also needs to be reduced. And finally, it's important that the diabetic retinopathy or development potential for diabetic retinopathy is monitored by regular screening. And if any develops, then action is taken to investigate this and instigate any appropriate treatment. So really controlling the diabetic retinopathy, avoiding being overweight and not smoking are very important factors to avoid development and progression of diabetic retinopathy. I would also add that some people are genetically more predisposed to developing retinopathy, and so in Asia, for example, and the Indian subcontinent, diabetes is extremely common, and again needs to be very carefully looked for, and if it does develop, very carefully controlled.